Hello, my name is Caleb Smith with the Rocket Miner newspaper, here with an update for December 7th, 2020. I hope you all had a good weekend. I was, like many people, able to enjoy the lighted parade that went through downtown Rock Springs this weekend. I would point you to an online gallery at rocketminer.com. There's some wonderful pictures. Not taken by me. I can't still quite figure out my camera settings. But people more talented and with a keener eye than I captured some great images of the mayor's tree lighting and the subsequent parade that snaked its way through Rock Springs. I'd strongly encourage you all to check it out. It lifted my holiday spirits to see that. Moving on to today's news. The biggest thing, in my opinion, is the fact that Governor Mark Gordon announced a new set of health orders that will take effect later this week, including a statewide indoor mask mandate. Now, starting Wednesday, new health orders are going to take into effect, and those include requirements for state coverings, or face coverings. There will be some business restrictions, and some of the they keep adjusting the number of people that they say it's safe to have crowdings with. That is being shortened once again. Just reading from the news release that the governor sent out today. With Wyoming hospitals seeing record numbers of hospitalized COVID-19 patients and rising deaths, Governor Mark Gordon has announced a new approach that protects the public and keeps schools and businesses open. This involves requiring face coverings in certain indoor public settings in all counties, reducing group sizes, and reducing hours of businesses where COVID-19 transmission is more likely to occur. Now, let's start to break that down. In Sweetwater County, those of us who are abiding by the health orders that's in place, we shouldn't see much of a difference. In a press conference that followed the announcement, Dr. Alexia Harris, the state health officer, explained that a lot of the changes that are being announced in the governor's order have already been implemented around the state in some of the extended health orders. Sweetwater County is one of those places. Our original health order went from like mid-December just to this past Friday, December 4th. Our latest order, which went into effect on Saturday, December 5th, currently extends through January 8th, 2021. And there are some things just defining minors as saying that if you're under 12 years, you don't have to have a mask, but if you're 12 and older, you would be. Some of the businesses' sizes have been adjusted. The statewide order, in addition to applying to all counties, there are some larger changes that are taking effect. Those include bars and restaurants will be closed from 10 p.m. to 5 p.m. for on-site consumption. Now, takeout's still going to be allowed, or delivery options during those hours, to the extent authorized by law. And restaurants in travel centers and truck stops will not be ordered to close. Other changes impact some of the smaller group settings, such as tables and booths at restaurants and bars must be limited to groups of no more than 6. Previously, it was 8. Though exceptions are included for everybody's in the same household. That's not everybody's in the same family. It's like, is everybody under the same roof? Similarly, that grouping of 6 rules applies to movie theaters, performance theaters, opera houses, concert halls, music halls. Like I said, used to be able to gather in groups up to, or like I said, used to be able to have slightly larger groups. Now this group size is 6. And when it comes to gyms and workout groups, those classes are now going to be scoped down to just 10. Under the previous health orders, it was 25. Slightly larger, it's in slightly different settings, and of course, one of the things that you may remember from the original lease was places where infection's more likely to have. Grocery store, when you're in and out, smaller risk. If you're kind of staying more in a singular place, such as church or a movie theater or a restaurant where, yes, we still have exceptions to be able to take your mask off to eat. Yes, you can sneak it under there, or you can be creative with straws. That's too. But There are continuing exceptions. The biggest one that people cite would be if you have a health condition that precludes you from wearing a mask, that gives you cover. You don't even have to prove it. You don't have to have a little card or anything. That's just that was both part of the county health order and part of the latest statewide order. But talking about other groups, gatherings without required distancing between groups are limited to 10 individuals. Previously that was 10. Indoor events may allow more than 10 individuals, but no more than 25% of a venue capacity with a maximum of 100 people. We saw that with some of these events already this past fall, was like at swimming meets. There was a capacity. Volleyball games, there was capacity for the indoor stuff. Groups of attendees seated together at an event must be limited to 6, previously 8, but exception may be made if they're all from the same household. So, like I said, similar rule across the board. They're trying to make things line up so that there's less confusion. This is not fun as it is. Trying to make the rules simple and straightforward as much as possible is one thing that they're trying to do to make it easier on people. And one of the things that Dr. Alexia Harry stressed, that, as others have, is that this is just for now. This is not forever. But there are increasing concerns about the infections in the state, hospitalizations, looking at the number of beds. I'm consistently seeing the number of adult intensive care unit beds become less and less and less. We're seeing there are some hospitals in Wyoming that they are at capacity. In some cases, thanks to federal funding and just some creative outsourcing, we've been able to bring in some temporary resources to alleviate the stress on staff. People who work in the healthcare industry, they're at a higher risk of becoming infected, and at minimum being quarantined if not catching the virus, and that takes them out of the fight. There's a great demand for nurses, respiratory experts, and we've been able to bring in some in the state, but with the demand increasing statewide, this is not something that we can count on for sure for the ways coming. That's why we're trying to encourage people to do the simple, compassionate, considerate steps. Wash your hands, maintain distancing where possible, wear a mask when around other people, limit your trips out into the community and to groups as much as possible. Stay home if you're sick, and get tested if you've had exposure and or if you're experiencing symptoms. Free testing's available. There are an increasing number of places that are out there. Be looking in the Rocket Miner shortly for an expanded list of testing sites. We don't promise it's got everything, but we've been working extra hard the last couple of days to better outline what options are available to people. So, just one last thought that's been bouncing around my head since Dr. Alexia's conference. She said that she admitted that, yeah, this is flu season, and there are challenges that hit us every year. But especially in light of the coronavirus, which is more infectious and deadlier than other seasonal flus. She stressed that right now, there are people being hospitalized who normally, replay this year exactly the same way that without COVID, they would not have ended up in the hospital. Replay this year without COVID-19, and these people would have lived for several years to come instead of filling our funeral homes and our cemeteries. We have personal choice that we can bring to bear against this. Through cooperation, through common sense, we can blunt the impact of this. We need to see a sustained turnaround, a decline in cases, to be able to get back to some sense of normal. That was something that was stressed here. You may watch the numbers, and it is nice to see them turn in a direction you haven't seen in a while, because we've seen a lot of bad news. And I'm hopeful that we will be able to report more recoveries and fewer deaths as more people get their head in the game, as more techniques become more effective to fight the virus, as a vaccine becomes available and widespread. There's also some talk today that some of the vaccine providers, while confident about the effectiveness and safeness of their product, their ability to mass produce it in quantities that are needed right now, it's going to take a while to ramp that up. It takes a while for that distribution model to get to places like ours. It's probably going to take multiple shipments, multiple waves for us to be able to just treat our highest risk people, our healthcare providers, those in long-term care centers. And then as it goes on, then they're going to go work their way down the list when it comes to need and just who shows up in line. I will do my best to be there when it's available to the public. That's just what I'm choosing to do as part of my role here, in addition to just trying to make sure that we're informing you all, providing information as much as we can, so you all can make informed, smart, loving decisions. Anyway, this is Caleb Smith with the Rocket Miner newspaper, wishing you a good day and a safe tomorrow. Bye.